Around here, we ride a lot of different things. A lot. Maybe it's because we know it's not just where you're going that counts, but also how you get there. That's why we have Blue Bikes, a simple and affordable bike share program just for our city. And if it's been a while since you've ridden a bike, don't worry, it'll come back to you. It's just like, well, you know. Blue Bikes, enjoy the ride.
I'm self-employed with a small business. I've got a handful of employees, and part of my incentive package for them with their salary is that I cover their health insurance. I came across Blue Cross Blue Shield 15 years ago, and I've been with them ever since. Blue Cross has made a difference in my life and my employees' life by giving us the security of knowing that Blue Cross Blue Shield will stand behind us, whether something planned or something urgent. We have Blue Cross Blue Shield to back us up. That gives us peace of mind.
Doctors New Orleans is underwritten by Blue Cross and Blue Shield of Louisiana, Winn-Dixie, and New Orleans Living Magazine, highlighting the best of our city.
Good evening, I'm Maria Mura. Welcome back to our show. Tonight our topic is sports injuries. My guest is Dr. Nelson Mead, an orthopedic surgeon in New Orleans who's fellowship trained in sports medicine. Dr. Mead attended Tulane University School of Medicine, where he also did his orthopedic surgery residency. Upon completing his residency, Dr. Mead pursued his orthopedic surgery sports medicine fellowship at the Curlin Job Orthopedic Clinic in Los Angeles, where he learned how to care for everyone from weekend warriors to the most elite athletes in the world, and we're so excited to have him here tonight. Thanks so much, Dr. Mead, for being here.
Yeah, thanks for having me.
Okay, so before we get into all, the issues with sports injuries, let's talk about your, your credentials and also the fact that you just moved back to New Orleans. How did that happen?
So I had the opportunity to go out to the Curlin Job Orthopedic Clinic, which has the moniker of being the first orthopedic sports medicine fellowship program created. And it's an institution that has done amazing work and been on the leading edge of treating athletes around the world for decades. And so it was amazing to have that opportunity. But I grew up in Shreveport. Louisiana has always been my home. So I felt a calling to come back, and I'm happy to be here.
All right. And also, I believe medicine runs in your family, doesn't it?
It does. My father's also an orthopedic surgeon in Shreveport.
Okay, wonderful. And now why did you decide to specialize, number one, in sports medicine and that institute in particular? I'm sure you've been exposed to so many, different athletes, like you said, and how did that shape you as a surgeon?
So really, when I was looking at fellowships, I had to reach back and think what brought me here to begin with. And that was sports. I mean, I was fortunate to have my father as my best friend growing up, but I also had an idol in a man that went to work every day, loved what he did, what he was doing with his hands. And then when, players got hurt in the games I was playing, all the parents looked to him to take care of the guys. And so kind of put it on a pedestal, and that's what got me into it. And when I thought back on that, sports is what drove me into this, and I hope sports is what carries me through it.
Well, I love that. Well, I think, look, we're very excited. The Saints are doing great.
They are.
And it's incredible because, with the injury that obviously Drew Brees had, which was his finger, a finger injury, it's just that's what, the whole city was talking about. And also the importance of, where he flew out and just that, there's so much riding on the proper care, right, when it comes to these athletes. Yeah. So there's definitely, they have to trust their surgeons.
Oh, absolutely. And Dr. Steve Shin, he's a great guy. Steve is at Curlin Job Orthopedic Clinic, and he actually is the one that did Drew Brees' surgery and worked with him a lot last year, and he is such a great guy and very, very talented in what he does, and certainly at the forefront of various, procedures in terms of specifically taking care of athletes' hands.
Okay, and also, we love, the NFL, we love, Major League Baseball, but also, all of these star athletes were once children, right? And I do want to talk about that before we get into, the specifics. Is, as a physician, as a surgeon, are you a dad?
I am.
You're a dad. There you go. So there's these children today, they have something going on every day after school, right? They're in baseball, they're in soccer. Is there a lot of wear and tear that happens to children compared to, let's say, 20 years ago? Because sports have become very competitive, even at the high school level.
Yeah, so it's certainly an issue that has been at the forefront of orthopedic care over the last 5 to 10 years, as we've noticed sort of this increase in specialization.
Okay.
So the problem isn't the 10-year-old that goes one day to soccer practice, the next day goes to baseball,
okay.
A week later he goes to basketball. The issue is with the 10-year-old, for every day around the year is playing baseball, throwing constantly, having private, throwing coaches on the side,
okay.
And he's not diversifying. And so it causes a lot of repetitive load on certain parts of the body that aren't ready for that yet.
Okay, so it's just the child is just physically not ready to have that type of...
Yeah, I mean, being well-rounded in sports contributes so much to a well-rounded physique and a well-rounded development and sort of in our skills.
Okay, all right. Well, again, I just want everybody to know our topic tonight is sports injuries, so we're glad, you're joining us, and we have Dr. Meade here. Okay, so first, again, back to children, because I think it's so big, and, here in Louisiana, I mean, I think it's, or maybe it's across the country where, everyone's following not only college sports, but the high school teams, and, and again, our little league team that, they're world champions, yay. But I also want to say hello to a cute little boy named Jake, who's a wonderful little soccer player, and I got to know him, and I mean, he's playing sports every weekend, 3-4 nights a week after school. It's a lot on a child, and I actually asked, aren't you tired? Do you ever get a break? So as a parent, and for other parents watching tonight, how do you know when it's enough, so to speak? Like, what is enough for a child, or all child, or should we look at children the same in terms of what they can experience?
I think you have to try to be very attuned to what the child's feeling and sort of be able to know when their attitudes or when their performances change, because, as we get older, changes in performance may be a reflection of an injury or something like that, but as a kid, where we don't necessarily have great coping mechanisms, something like a decline in performance may be related to the fact that the kid just isn't having fun anymore. Wow. And I think, to me, that's the most important thing. Yes, being active, having the kids as much things as they can is great and very important. But if you notice that the kid's just not having any more fun with that particular sport, I think it's time to back off.
Okay, well, wonderful. Well, enough about kids. Now we're going to get on to the serious stuff with adults. Okay, we call it sports injuries, but a lot of sports injuries don't always happen playing sports, right? Mm-hmm. Okay, so talk to me about the more common sports injuries that you treat at your practice, Dr. Meade.
So, we strive to treat some of the injuries that afflict the, aging recreational sports patients or athletes. And that typically involves damage to the shoulder, whether that be rotator cuff injuries or what we call labral injuries. It can also include, as the evolution of hip arthroscopy has grown, that too has been able to change the way we treat certain hip pathology. And then, of course, the common knee injuries that you hear about, whether those be ACL, MCL tears, or it even be cartilage damage, which now, if we can educate patients to know that they have a serious problem, and we catch some of these things before they progress to significant arthritis, we've gotten so much better with our treatment that we can really help these people.
That's wonderful. Okay, so let's go back to the shoulder for a minute. So I know a lot of patients, I meet a lot of people, and it seems like a rotator cuff tear is pretty common. Okay, but I also hear that a lot of these patients, they wait before having surgery because they all think that, there's a lot of downtime. Tell me how the surgery is performed, what does it entail, and what does the recovery look like?
So typically, the way that rotator cuff surgery is done now is typically through an arthroscope. Okay. So essentially a camera, and using several other instruments through small incisions in the skin, we can go in and we can see the cuff that's been pulled off the bone and then reattach it using anchors, which are essentially, these small bioabsorbable screws that have a thread coming out of them, and we tie those back into the tissue to bring it back down to the bone. Yes, the recovery is long. It's arduous.
Right.
There is a lot of rehab involved, and it's a road, but in so many patients who are constantly in pain, it's definitely a road we're taking.
Right. And let's talk about Crescent City Orthopedics for a moment, because I know, your practice obviously is very comprehensive, okay? And you have an office in Metairie, you have an office in Slidell, but I know your reach is pretty big, but you also have in-house physical therapy, correct?
Correct.
Okay, which I think is super important considering the type of surgeries that you perform. Okay, so we talked about that, and then obviously dislocated shoulders. That happens a lot.
It does. Those are going to be more significant traumatic events, but those certainly happen in sports, whether it be, football, rugby, any of those types of sports, or from what I learned last year, ice hockey. These types of things can happen pretty commonly. And, what's affected can always depend on the age category, whether you're younger, certain structures of the shoulder tend to be more effective than others.
Okay.
And so treatment changes.
Okay, great. And again, since we're continuing on this whole sports theme, tennis elbow. We hear about that. What exactly is tennis elbow?
Well, it's kind of a misnomer. Not every tennis player has tennis elbow, but it's basically a tendinosis or a degeneration of the tissue on the outside of our elbow, and it causes pain like no other for a lot of people, and it can go on and on and on. But luckily, we've gotten pretty advanced with some of our non-operative treatments, whether that be PRP, which many people have heard about, or other less invasive procedures before someone has to go directly to surgery.
Okay. Well, I'll speak about a little personal experience for me, and I find that every time I don't really exercise very much, but for example, I was trying to do yoga, but as soon as I feel that, I'm having these repetitive movements, I start having a little kind of like a little crunch sound going on. I was told, I think it's intersection syndrome. Is that what it is? Why does that happen? And is it common?
It's common because you get inflammation of the tissue, and so as the inflammation of the tissue occurs, the tissue tends to expand.
Okay. And
is angry, and so the more movements and repetitive movements you put it through, the angrier it's going to get.
So why does it happen?
Well, because of that initial repetitive movement.
Oh. Okay.
And you may be doing that repetitive movement out of sync or inappropriately, and that may cause it.
Okay, definitely probably inappropriately, is because I don't do it often, but that gives me a good reason to stop doing it, because I was like, oh, that hurts. Okay, big topic, Tommy John surgery. Okay, so we talked about the shoulder, now we talked about children, we talked about athletes, and now baseball. Tell me I've heard about it, but what is Tommy John surgery? And how does it happen? Why does it happen?
So
why is it needed?
This is when I start to get a little excited.
Okay, I know that's a big topic for you.
It perfectly ties into the kid discussion we were having before because of the evolution of how we understand this injury now. But
I'd like to put an image up. There you go. Tommy John. Is that Tommy John that we're looking at right there?
Yep.
All right. So what are we seeing right here, doctor?
So what you're seeing right here is you're seeing the inside of the elbow.
Okay.
And what that is that it's a certain technique of replacing or reconstructing the ulnar collateral ligament of the elbow, which for me or you in everyday life probably does not matter.
Okay.
But for high performance pitchers, when they go into what we call the late cocking phase of throwing, when they bring the arm back, with those guys throwing as hard as they do, they put a ton of force on the inside of their elbow.
Wow.
And that ligament's responsible for being able to hold the elbow together at that point. But it's all like a rubber band. So think about it, if you use this rubber band, you keep using it, you start to see small tears, you start to see holes in it, and eventually it just snaps.
Wow.
So that's what's happening in these guys. And so historically, previously, this was a career-ending injury. One of the partners at Crescent City Orthopedics with me, his father is a Red Sox Hall of Fame pitcher, and he was telling me a few weeks ago that this, in fact, ended his career. And so until Frank Joe about it, Carl Joe Orthopedic Clinic in Los Angeles, came up with this reconstruction, there wasn't a good solution, because if you try to repair bad tissue to bad tissue, you still have bad tissue. So the reconstruction essentially recreates that whole ligament using a different ligament.
So where does that ligament come from typically?
So most people do that from a ligament that runs from the wrist up the forearm. You can do it for one of the hamstrings. So in some of the revision cases we did last year in Major League pitchers that have often, either they don't have this or it's already been used, you have to use the hamstring.
Wow.
There are some who say that you don't necessarily need to do all that and you can use a cadaver
Okay, and what I've heard about, there's a little controversy when it comes to this Tommy John surgery, is that there's some young baseball players who really should not be getting this surgery so young. So tell me about that.
Okay, so that's an interesting thing, because so that brings us back to this whole discussion about overuse injuries in young athletes. So we thought the repair was a nightmare. It didn't work. Bad tissue to bad tissue, right? Well, as we started to see a lot of these overuse injuries occurring in these younger athletes, we noticed that damage to that ligament or that injury is a different type of injury than the injury that occurs in the older guys who have pitched in 95 for 10 years. When it happens in a 15-year-old gymnast or a wrestler or a 14-year-old baseball player, the rest of the ligament's great. It's just that they've experienced too much force across the ligament all at once and it snaps.
Wow.
So for those guys, you could do a repair. But it's interesting because all of our best outcomes research is in reconstructions. And so when I was with some of the guys out in California, and you had an 18-year-old who was coming in and he's projected to be a first-round draft pick, and the parents and the kid come into you, the only thing you can honestly tell them is that the most predictable, most reliable results I can give you are from the reconstruction.
Wow. Okay.
We don't have enough repairs out there performing at that high a level to reliably say that they're going to do as well as a reconstruction.
Wow. And so have you had the experience where, again, to tell a parent it's not appropriate for your child to get this type of surgery at this time?
Absolutely.
How does that conversation happen?
Well, the kid's usually thankful.
Okay.
But, a lot of people have this misconception. My kid's going to go in and get Tommy John, and all of a sudden he'll be able to throw harder, throw faster, and be a better pitcher. There are a lot of things that go into that, and yes, you may eventually, if you're 16, 17, but it's hard to project that. And in fact, what we really think is that the reason, if those kids are able to do that, is because having the Tommy John surgery forced them to sit out for a while and have a real appropriate rehab where they concentrated on things like stretching, flexibility, core strength, all those other things that can generate force for a velocity on a pitch than just the elbow.
Wow. And also I think we have to remember, Dr. Mead, that especially with kids or teenagers, after all, sports are supposed to be fun.
Absolutely.
Right? Let's remember that, parents. Sports are supposed to be fun, and if you have a child that has amazing talent, you usually know pretty early on. But also, let's not push our children, to just wear their body down to the point that they can't even, enjoy sports as an adult, right?
And it goes back to the thing I said originally. If the kid doesn't seem like he's having fun with something, back off.
Right.
Because that's the most important thing. And if they're not fun, they're not going to be motivated to perform at the highest level anyway.
Absolutely. And like you said, I think that's a big thing that you just said there about rehabbing and proper stretching and, all of that. One other topic, since, you just came back from Los Angeles, obviously you were in an environment at that practice where you experienced and worked with a lot of, high-level athletes. What are your thoughts on how can we protect the athletes from certain injuries when it comes to sports? So that's a big topic right now. I know we talk about it with a concussion, but what about the rest of the body?
I mean, it's big. We've taken a lot of leaps in that in terms of the younger guys.
Okay.
Limiting pitch counts when they're adolescents and things like that to prevent the arms from seeing too many numbers of pitches or throws.
Okay.
So we're doing things to try to curb some of the overuse injuries, and that's the thing. That's the thing we think is probably the most important.
Okay, and is it the team physicians or physicians like you, Dr. Mead, who basically have worked with these sports organizations to determine, better rules or safety rules for these athletes?
Yeah, no, so it's
regardless of what level?
It's some of the greats out there, like the Neil Elitroshes, the Jimmy Andrews, those guys that have really spearheaded this and kind of.
I love this.
It's a team approach. I mean, in the most sense of the word that I could ever imagine, because you have so many people with a vested interest in this, whether it be the athletic trainers, the physical therapists, the coaches, the fans. So, everybody's got to work together to really tackle these problems. And so the physicians, the trainers, everybody's been able to get together and really make progress in these areas.
Okay. And you as a surgeon, Dr. Mead, tell me what, I know you do shoulders, I know, you perform knee surgeries, what would you say is really your specialty? Is it arthroscopic surgery?
I would say it's sports-related injuries and their rehabilitation.
Wow, fantastic.
So because I'm not going to commit to doing an arthroscopic surgery if I think I could do it better in an open manner.
Okay, great.
So I hate to restrict myself to arthroscopy, but for me, I'm about getting people back to the way they want to function, what they want to get back to doing before this all happened.
Absolutely. And also with these sports injuries, it crosses over into work injuries as well, right? Because
Certainly.
you have a lot of people with certain jobs, it's a repetitive motion as well, right? So how do you work with, with patients who come in, they have certain disorders or maybe injuries, and again, your goal is to get them back to work.
So some of the more common work injuries, I think, are great for where physical therapy comes in.
Okay.
Because you can work with a physical therapist to really teach those patients, because they've never really had any formal training on proper body mechanics.
Right.
So the ones that are more prone to work-related injuries are doing a lot of lifting, a lot of pulling. So having them go through physical therapy, develop a maintenance program so that if they do have an injury, it's not as severe the next time around, and also teaching them the proper body mechanics and things like that are pretty vital to getting them back and moving again.
Okay, and we only have a few minutes left, Dr. Mead. So, our population, obviously we're living a lot longer, which is a wonderful thing, but I always say if I'm going to live longer, I want to live well, right? So for, whether you're an athlete or someone, who's about to just wants to take on, more physical activity, what advice would you give?
So I think the most important thing was a lesson that I was taught by one of my mentors last year, who said, all these injuries you're seeing in these middle-aged people, active middle-aged people, unless it's a big one-time injury or for one or two reasons, either they've all of a sudden increased the intensity of what they're doing, or they've all of a sudden changed what they're doing. So they've gone from riding a bike to running 5 miles on the road.
Gotcha.
So what I would tell people is, I think it's incredibly important to stay active and get involved, but to vary it and then also gradually increase whatever you're doing, so that you're not trying to get back to what you can do at 25 when you're 45.
Right. I always say, look, if I'll take on a little bit of exercise, but I always say, I'm doing pretty well for my age. I have to be realistic, right? I think that's important. But look, this is such a great topic. And Dr. Mead, it's great that you're here. We're very excited that you came back to this market. And of course, Louisiana's your home.
It is.
You're a Louisiana boy.
Always will be.
So what are your goals in terms of establishing yourself back in this community, both as, professionally and personally as well?
So ultimately, I want this to be a place where some of our top-end athletes don't have to seek care anywhere else.
Right.
That we've got all the tools here, we've got all the talent, all the people around, and we've got the infrastructure so that they don't have to go all the way back to California or Florida or wherever to receive treatment. We got some of the best athletes in the world, so why shouldn't we have the best care for them?
Absolutely, I agree. And also, again, I love that you brought up physical therapists. I think that they're a very vital component, right, to what you do as a surgeon in terms of rehabbing the patient.
My surgery is not any good if that physical therapist is not good. They make us a success.
Okay. And lastly, Dr. Mead, your thoughts on regenerative medicine, because I know that's a really big thing when it comes to especially sports injuries like the PRP. We talked about that. What are your thoughts? Is that something we're going to see a lot more in your field of medicine?
So I think we need to understand what PRP and things like that are used for, why we think the science makes sense. So we can't just broadly apply them and say that someone with significant knee arthritis, they're going to have a new knee when we inject PRP. That's not the case.
Okay.
But certain things that are responding well to it make sense, like tennis elbow. It makes sense that injecting PRP would work there.
Okay.
And it's the same reason why we've always thought, stimulates an inflammatory response, puts down tissue. You're not ever trying to recreate a whole new knee or cartilage. And anybody with those expectations, I think they're going to be disappointed.
Absolutely. Well, Dr. Mead, this was fantastic.
Yeah, absolutely.
I really appreciate you
Enjoyed it.
stopping by, and I know we're going to see each other a whole lot more. So, all right, thank you so much for being here. Great insight tonight. For those of you who wish to receive information or you want to contact Dr. Mead's office, you may call 504-233-0986, or you can visit CrescentCityOrtho.com. I'm Maria Muro. I want to thank you for tuning in to Doctors New Orleans, and remember, if it's about health, we cover it, and we always enjoy hearing from you. Thank you for watching the show tonight. We hope you found the show informative, educational, and inspirational. Stay healthy and good night.
Doctors New Orleans is underwritten by Acadian Ambulance Service and New Orleans Living Magazine.
Around here, a meal is an adventure. A football game is a religious experience. And just walking down the street can lift your soul. That's because we know that getting there isn't just half the fun. It is the fun. So hop on and grab New Orleans by the handlebars. Blue Bites. Enjoy the ride.